Friday night in Mansini, in Swaziland. There's a good chance that several of these young people are HIV positive, as a quarter of all adults here are living with HIV. But much is clearly changing for the better in this small, landlocked country. Swaziland is one of 22 low and middle-income countries with the highest estimated numbers of pregnant women living with HIV. HIV is passed on to an infant either during pregnancy, the birth itself, or subsequently through breast milk. This can now be prevented, but it is essential that healthcare providers, pregnant women and their partners, people living with HIV, and the wider community all have the knowledge and skills to manage the demands of the epidemic. Khululiwe is 14 years old. She was born HIV positive. Both her parents died from AIDS-related illnesses when she was 8 years old, and she's currently in the care of this orphanage at a rural Catholic mission.
I'm 15. That's a taking tablets. Nengabe ngifuna kunqoba lesimo lengozo ngithatha emaphilisi njengempilo yami ngihlale ngwanatha khona ntophila iminyaka lemine.
She's been taking antiretroviral drugs, known as ARVs, since they became available nationally in 2004. These drugs are helping her live a longer life and will also have a positive impact on her future baby, if and when she chooses to become pregnant. Importantly, ARVs can also significantly reduce the risk of HIV transmission to any sexual partners. With adequate care, support and empowerment, if Khululiwe has a child in the future, that child will almost certainly be born without HIV. Change and hope are on the horizon. The prevention of mother-to-child transmission of HIV, PMTCT, is a top priority for the government of Swaziland, and there is reason for real optimism. In fact, the talk is not just about preventing mother-to-child transmission, but taking action to eliminate it altogether.
I am extremely encouraged by the PMTCT program for the simple reason that it's really the first practical way in which HIV can be eliminated, because what is actually happening is that those mothers who have gone through the PMTCT program are giving birth to children who are HIV-free.
An important part of the program aims to ensure that women living with HIV can lead fulfilling sexual and reproductive lives with the same choices and opportunities as any woman. But this is often much easier said than done.
Usually, in most cases, people always feel that if we are HIV positive, we are not entitled to sexual and reproductive rights. We are not supposed to enjoy sex. We are not supposed to get pregnant. So I'll make an example. In one of the support group, there was this lady who was active in the support group, and then she felt pregnant. So people were so angry that she got pregnant because they felt like she's HIV positive. It meant that she slept without using a condom and stuff, and accused her of certain things. So we had to sit down and talk about it and make people aware that even though you are HIV positive, you are still entitled to sex like any other person, and you are also still entitled to getting pregnant, to your sexual reproductive rights. Because I think it was because when HIV first came, we were advised not to get pregnant. And then now it has changed with the introduction of PMTCT.
Programs to eliminate new HIV infections in children and keep their mothers alive aren't only aimed at women living with HIV. They start with preventing HIV in women in the first place and keeping HIV-negative women negative. Because pregnancy carries with it an increased risk of acquiring and transmitting HIV, this is especially important for young people. This is the weekly meeting of the Youth Action Group of FLAS, the Family Life Association of Swaziland. As well as meeting for fun, serious discussions about sex and sexuality are led by young people themselves.
Okay, right? And the penalty yeah. Meaning it's a strong parents. So okay. Naslala strong. People letting zagalist banana just as sexually active.
If you know your goals and what and if you know your values,
Outside this meeting room, just like in other health facilities, condoms are freely available. Campaigns to support safer sex are being actively promoted across the country. The full range of PMTCT services are now available at the majority of the country's public health facilities that offer maternal and child care. King Sabuza II Clinic, a government-run facility, provides family planning, antenatal, postnatal, child welfare, immunization, and HIV testing and counseling services. These services are integrated under one roof, so a woman seeking family planning advice, for instance, can easily access an HIV test.
When pregnant women come, we direct them to room 1, this side. In room 1, we do the routine antenatal care. And in addition to that, we offer them HIV testing and counseling. All the women, they end up testing for HIV. And at this facility, it has become routine that all our pregnant women, they test for HIV. We send the blood specimen to the lab, and when the results come, we assess them for eligibility for ARVs. If they are eligible, we start them on ARVs. If they are not, we start them on cotrimoxazole or prophylaxis. If they have any opportunistic infections, we treat them.
Okay, just in the wapandina.
All women who come here are encouraged to take an HIV test that includes both pre- and post-test counseling. Having all kinds of sexual, reproductive, and HIV services in one place makes access easier for everyone. Integrating the services is helped by a staff rotation system that systematically builds the competency of all staff on the key services. As in many countries, there are significant rates of unintended pregnancies, HIV, and maternal deaths related to HIV, especially among young people. However, offering a full range of integrated sexual and reproductive health and HIV services is already starting to pay off. Here at FLAS, the Family Life Association of Swaziland, offering integrated sexual and reproductive health and HIV services routinely to all clients, is taken a step further as a way to reduce HIV-related stigma.
Tindlu tethu tekululeka lana tibhaliwe lamnyango ukuthi nginambolo bani kofa angabhala ukuthi kwendiwani la ngekhathi ngalokho ukuthi la ngekhathi uthola konke longakhona kusitakala ngakho nangabe utele kutohlela umndeni siphinde futhi sikululeke nokuthi isimo sakho sengade yasadi yini nangabe ufuna ukusipopola ngaleso sikhathi siyachubeka futhi bese sesiyakupopha khona la ngekhathi awudzingi ukuthi uphume uye kulenye indlu info lesenta ukuthi singabhali ukuthi kule ndlu le kwendiwani sendela lo ukuthi umuntu atokhululeka.
Another important part of PMTCT is making sure that all communities know their rights and have access to services. FLAS operates a mobile clinic, as it is often difficult for a woman to get time off from work to travel to a clinic. Instead, the clinic, which offers a range of services, goes to her. On other days, the mobile clinic visits rural areas to make sure people living in the countryside also have access to its services.
Cha kusho ukuthi ekutholaneni kwethu uthandana kwethu sathandana sisengazi ngalokuthi isimo sethu kwenkadi sathandana kwase kuba nekugula lokwaba khona kulomunye wethu kwacala mina nje ngagula ngaba ne-TB ngathi uma ngitreatelwa i-TB base sebathi manje kufuna ngicheke nangale ngathi uma ngicheka ngala bathola ukuthi laba uma bangicheke ingadi yami yakhanda ukuthi vele senale gciwane base bathi ngcono ngicale ngitreatele i-TB kuqala kube khani ngibuya la kulena ngatreata yona engayiceda athi sesiyicedile ngase sengiyamtshela ke nalona ukuthi lena ngihambe njani esibhedlela ngamtshela ukuthi bangibambe ukuthi ngikanje kanti vele besike sibesesicalile kuhlala silala kanye naye waseke naye wasuba ngumuntu naye lo sukumele etulo wathe nama ngcono ngihambe ngiyohlola wahamba wayohlola naye bamtshela ukuthi vele kanje nethi kwakhanda kusathi yena masotsha akha bese asetulo bathi ngoba lamasotsha asetulo alo angefe ahla nje tindo letawu kwakha umtimba lamaseko lamathathu kuze asengacali kunathe amaphilisi mina ngekuthi kafele ngathola igciwane nginale TB le TB yehlisa lamasotsha alomtimba kwase kubona ukuthi vela angisale ngiwacala lamaphilisi ngafele ngasemukela lesimo saphila naye angakawa nathi le maphilisi mina ngiwanatha kwahamba naye kwafika esigabeni sekuthi naye sayadingeka lamaphilisi waseke naye sofele naye kuyathamba ngoba naye bese vela wafisa lamaphilisi ukuthi kube manje sofele uyawanatha ngoba naku nami sengiyawanatha ngoba kude lokunye lokungaligobisa ngaphandle kwalamaphilisi sawu lapho manje nyalo nje ngikolo ngathi thine naye asiyuhlukana sesingahlukanisa ngona kufa sizathu siyasana impilo yethu futhi nekuphathana besiphethene kahle nabasali bakhe akasanabo ke lo abasali bakhe umsali wakhe nje sengimi engimele ngimnake nokuthi ngimnaka kanjani nokuthi ulala udlile nokuthi uyambatha ufuna nakwe yimi umntwana simfikela ngekuthi ahambe ayesikalini lo bafike bamnika imithetho labamtshela yona bamnike nalamaphilisi la kumele awanatha aphile ngawo ngoba naku uzotethele kanti nale gciwane bese futhi kumsiza la kutheni nabe nolwazi ukuthi thina naye sekufuna siphile kanjani noma abe mhlambe siyafuna kubambana mase kufike esimeni sekuthi mhlawumbe sekukhona esingafuna ukwenza sesiyazi ukuthi nesiyenza kanjani njengakuthi sesiyazi ukuthi kufuna simasho ukuthi siyalala silale ngecondom kuze kufikeleke lo mntwana kanye nanaye futhi. Lokunye futhi kufuna ukuthi sisame indlela yokuthi mhlambe silungiselele malanga elokubeleka kwalomaka ukuthi sente sure ukuthi ubelekele esibhedlela. Mhlambe nako lokho kungenda ukuthi lo mntwana abe nophilile ongeka luthole.
Outreach to rural areas is a key component of success, and as shown by Tabile and Sviso, it clearly had an overwhelming effect on the choices that couples are now making in managing their fertility intentions and seeking health services, with or without HIV. But HIV-related stigma remains an ever-present reality. Integrated services can help to overcome stigma because people can access many different services at a one-stop shop. Even so, stigma still affects how people living with HIV feel about themselves, are treated by others, and can impact on their fertility decisions and how and why they access health services.
Okay, to be stigmatized is such a painful thing because when you're stigmatized, firstly, it's like your self-esteem is compromised, which means you lose self-confidence. And then also, there are certain things that you feel the pain because in most cases you always feel you have to be accepted. You are HIV positive and you need acceptance, and only to find that you are stigmatized, and then you feel so bad. Sometimes you feel like maybe I shouldn't have talked about it. I should have just like kept quiet and not disclosed.
Disclosure, when you reveal that you're HIV positive, is still a big issue. For some HIV positive people, disclosure comes at a high personal cost. Studies have shown that intimate partner violence, or even fear of it, and rejection are a growing reality for many women living with HIV. So while it is easier to talk amongst themselves, public openness still keeps many in the dark.
Okay, when I first discovered, I was in a relationship, and then I got sick. I had TB, and then I went to the hospital and I was tested as HIV positive. I came back. I couldn't tell him I was HIV positive because firstly I was still dealing with it. Secondly, I was afraid of the unknown. I didn't know what he was going to say if I tell him I'm HIV positive. So I just like kept quiet for a long period of time until finally I decided I need to tell him. Whether he rejects me, I'll have to tell him. So I told him. So he started saying, whenever I came, he would just say, when you cook, just cook food enough for you only. I would take the broom maybe to clean the house. He would just say, please don't clean, I will clean for myself. He started to have so many limitations, such that I then realized that this is never going to work. So I cut the relationship.
But stigma is also being tackled in ways large and small, at individual and institutional levels.
Ukuthi le gciwane uma lifika emkhathini wenu akusilo lenehlukanisako uthandweni. Kufika kwalo gciwane azange libe se liba nekuthi mina ngihlukana naye ngoba vele bengivele ngimthanda. Kanti futhi nalokufundiseka nje emaredweni naseyibhedlela lokuthi lokudingekako lokuthi sithandane. Ngolo ungathi ngoba sengithandana naye noma sekungavelani kuveleni nguye engithandana naye.
As well as opening up discussions with young people about sex and sexual health, it's important to engage men. It has always been difficult to reach men, sometimes because of culture or ideas of what it means to be a man. Just as mothers-to-mothers programs which support new mothers living with HIV are functioning effectively, creative ways of bringing men together to discuss PMTCT through fathers-to-fathers groups are being explored. King Sabuza II Clinic has had success with what it calls Loveletters.
Since we provide maternal and child health services, most of our clients have been women, and in a way, the environment wasn't, conducive for men. So When we noted that, we decided to invite men to come to the facility. So now what we say is that if a woman comes to the facility, we also encourage them to bring their partners. So we have come up with a letter which invites the men. It doesn't specifically say which services they are coming for, but it's just a general letter which invites the men to come to the clinic. It's a love letter that we give the pregnant woman. But the challenge has been that men, they don't want to come to the clinic or to the facility because of work reasons. So when they come, we don't want to delay them. We want to see them as early as possible so that they can go back to work. We incentivize it by making them jump the queue.
Having children is something that can be planned or unintended for all women. This is the same for women living with HIV, and for young women like Kululiwe, who are growing up and exploring their sexuality. And there's nothing inevitable about the course of HIV. Antiretroviral drugs, ARVs, are the game-changing tool in HIV prevention. By taking her ARVs regularly, Kululiwe will be better able to protect her health and that of her baby. And if her partner is HIV negative, a growing reality in this small country, her HIV may never be shared, since treatment has been shown to be effective in reducing transmission, not only to children, but also between sexual partners. Women, men, boys and girls, like Kululiwe and Tobile and Sviso, should all have the benefit of knowing their options and the services available to them. This can pave the way for a brighter future of eliminating transmission of HIV from mothers to their children, and of keeping mothers alive whilst also protecting the sexual health of all people, especially the younger generation.
I'm switching the light off now. Ngiyacisha la.